In this video, we will discuss different ovarian cysts, their appearance in sonography, and how to differentiate them. And also we will discuss their significance and follow-up. Most of ovarian cysts are benign, such as simple cyst, hemorrhagic cyst, endometrioma, and mature cystic teratoma. But complex solid cystic masses are suspicious and need follow-up. I'm Dr. Asai here with a new sonography discussion on ovarian cysts. Don't forget to subscribe for every Monday new sonography discussion. Let's start with simple cyst. Simple cysts are anechoic lesions with posterior acoustic enhancement. They are unilocular with thin walls and no solid component. In this case, we can see a cyst in left ovary. If we measure it, it's about 5 centimeters. As it's obvious, no internal echo is seen inside the cyst. The cyst has thin walls and no solid component. Cysts may have thin septa. Cysts with thin septa are not simple, but still benign. In this case, we can see a cyst with thin septa in right ovary. The septated cyst in this patient is about 6 centimeters. There are 2 criteria which make a septated cyst suspicious, needs further workup. There are thick septa and mural nodules, which we will discuss it later on. In this patient, we can see the urinary bladder and also the uterus with endometrial cavity. Hemorrhagic cyst is another benign type cyst. As we can understand from its name, it contains hemorrhage inside the cyst, causing internal echoes and septations in sonography, but no internal vascularity in color Doppler sonography. In this patient, we can see the uterus and urinary bladder, and in left ovary, there is a hemorrhagic cyst measuring about 5 centimeters. We can see internal echoes and septations inside the cyst. Here is another patient with a hemorrhagic cyst in right ovary. We can see septations and internal echoes inside the hemorrhagic cyst. The septa in this 4 centimeter hemorrhagic cyst are thin, and if we use color Doppler sonography, no internal echo would be detected. So here is the hemorrhagic cyst inside the right ovary. We can see the borders containing thin wall. We can see internal echoes here. Many other thin septa are also seen. Some low-level internal echoes are also seen, showing mobile appearance, indicative of some fresh bleeding inside the cyst. The compressed right ovary parenchyma is also seen adjacent the cyst. Here we can also see the left intact ovary. Minimal amount of free fluid is seen in pelvic cavity, and we can also see the uterus with normal appearance and normal endometrial line. Here is again another case with hemorrhagic ovarian cyst. We can see the thin septa and internal echoes inside the cyst. Internal echoes inside hemorrhagic cyst may resemble solid component, but it has no internal vascularity, which can help us differentiate it. Also, hemorrhage has low level echo and no mass effect. Another benign cystic ovarian lesion is endometrioma or chocolate cyst. Endometrioma is a hypoechoic mass with diffuse low-level echoes and no internal vascularity, making a ground glass appearance in sonography. In this patient, we can see a 5 centimeter endometrioma in left ovary. Here is another patient with endometrioma. In 30% of patients with endometrioma, echogenic foci may be seen inside the walls. In this patient, the endometrioma is about 7 centimeters. A smaller endometrioma with echogenic particle adjacent to the wall of the cyst is also seen in left ovary, which is measuring about 2 centimeters. Let's again review the endometrioma in right ovary containing hyperechoic foci. Here is another patient with endometrioma. We can see the uterus, the right ovary containing small follicles, and the endometrioma in left ovary. Now let's discuss polycystic ovarian syndrome or PCO. PCO, which is very common in young girls, is a syndrome with many lab data and clinical presentations, such as irregular menstrual period, infertility, and hyperandrogenism. Sonographic appearance of PCO is increasing the volume of ovaries to more than 10 milliliters, increased the echogenicity of ovaries, and also existence of more than 20 follicles in each ovary. Here we have a case with suspicious malignant ovarian cyst. In this video, we can see the urinary bladder. We can see the uterus and endometrial cavity here. We can see the right ovary and its follicles, and adjacent to the right ovary is a big cystic lesion measuring about 14 centimeters. We can see the cystic lesion and its borders. The lesion has thin septa but containing many mural nodules, internal echoes in the cyst, and heterogeneous solid components. These criteria are suspicious criteria for malignancy, which needs further workup. We can see a septum here inside the lesion containing mural nodules, which is very important for further workup and suspect for malignancy. We can see internal echo inside the cyst, which indicates hemorrhage inside the cyst. In some parts, no hemorrhage is seen and the cyst is anechoic, but in this part has internal echoes. This part of the cyst is similar to simple cyst, but of course the total cystic lesion is complex and suspicious. We have hemorrhage inside the cyst. We can see mural nodules on thin septa. We can also see some nodules on walls of the cyst itself. The most important criteria for being a malignant lesion is existence of heterogeneous solid focus inside the cyst. We can see a solid component inside the cyst. Of course, no internal vascularity is seen inside the solid component, but still suspicious for being malignant. And further workup by pelvic MRI and also lab data correlation for ruling out malignancy is very important. Mature cystic teratoma is another benign cystic lesion. In sonography, we see teratoma as a hyperechoic mass, as we can see in this patient in left ovary, a hyperechoic mass. It's measuring about 3 centimeters. Teratomas are usually unilocular and show no internal vascularity. As we explained earlier, they are hyperechoic and can be diagnosed easily. In this patient, we also have a suspicious cystic structure in right ovary, showing suspicious criteria of malignancy which were explained earlier. It is about 4 centimeters, and the criteria suspicious for malignancy in this right ovary complex cyst are thick wall, mural nodules, and complex heterogeneous cystic solid appearance. So further workup with pelvic MRI and correlation with lab data for ruling out malignancy, and also follow-up with sonography in this patient is recommended. If the video was helpful, please like it, and if you have any question, be free to ask it in comments.